Well, Dr. Adami, just like with people having missing a tooth sometimes for a long time and nothing all that bad is happening, people also have root canals and never had a crown or over it after they did a root canal, and the tooth is still there. Yet every dentist proclaims that you should cap or put a crown on it immediately. Again, tell us what's going on here.
I sure can. Many people don't fully understand what a root canal is. Essentially what it is we remove the nerve that lives inside the tooth. When we remove that nerve, we also remove the blood supply to the tooth, and the tooth has a tendency to get very brittle and can crack much more easily than a tooth that has a live nerve in it. So after that tooth has the nerve removed, you really should protect it by covering the entire tooth with what we call a cap. It's essentially a thimble of metal or porcelain that surrounds the whole tooth and prevents it from cracking. And it should be done on every tooth that has a root canal done.
Okay. So the tooth gets brittle. I didn't quite realize, or has a tendency to get brittle at least. I didn't quite realize that. I did realize that, and I thought that might have been the only reason, which it is not, and that is, as you have the tooth and as you drill a hole in it to make the root canal, it becomes kind of, hollow. And becomes like a pipe.
Sure
and
does.
Pipes, as such, can break apart easier if it is made out of porcelain, stone type of stuff. But on top of it, that little pipe, kind of like hollow rim around it, it can become basically more brittle. That's what you're saying.
It certainly can.
Okay.
It certainly can. In order for us to remove the nerve, you're absolutely right. We have to drill a good sizable hole in the top of the tooth. And just the fact by doing that can actually weaken the outside of the tooth. Often, many of these teeth need to have the nerve removed because bacteria has gotten down into the nerve called a cavity. Oftentimes, we'll see very, very large cavities on top of the hole that we have to drill. Oftentimes, you're left with just a really thin eggshell of the walls of the teeth. And I can guarantee the first time you bite down on a pizza crust or a crunchy peanut, you will crack that tooth in half, guaranteed.
And when it cracks, I can assume that it not necessarily cracks above the gums or the bone lines, that it can crack all the way through and must be then, well, it's like a broken rack, must be difficult to take out, right?
That's exactly right. If the crack is a small crack, we can sometimes still place the cap over it. But if it cracks right through the body or right through the main part of the tooth down into the bone, there's nothing we can do, and you wind up having to have that tooth taken out, leaving you with a very expensive option of placing an implant in there or a denture or bridge or what have you. But yes, if it cracks down deep into the tooth, you almost assuredly will have to have the tooth taken out.
And then the whole root canal was a waste, basically, in terms of money and in terms of everything, because now it's gone. You need an implant. You're back to the very expensive option.
That's it.
Yeah. Well, all right.
That's
well,
exactly right. I often tell my patients that they should protect their investment in the root canal by placing a crown. You're right about it being lost.
That's a good way of putting it. Thanks again, Dr. Adami. Bye bye.
You're very welcome.